leading medical oncologist, Dr. Mark Tuthill, to discuss breast cancer and the important work the medical profession is doing to address this life-changing disease. Today, we are talking about an issue that may not be as highlighted as much as others, but is just as prominent: recurrent breast cancer. Good afternoon, Dr. Tuthill.
Brilliant. Thank you for inviting me to talk to you today.
Not a problem. It's a pleasure. So could you tell us more about yourself and your work?
So I'm a consultant oncologist. I specialise in the treatment of early and advanced breast cancer, which is also known as secondary breast cancer. I work at the Churchill Hospital, which is based in Oxford in the UK. And my main areas of interest are targeted therapies. That's therapies which are specifically designed for a person's individual cancer, and also immunotherapy for the treatment of cancer.
Great, thank you very much. So let's get started with the questions. Number one, what is recurrent breast cancer, and which type of breast cancer is most likely to recur?
So recurrent breast cancer is breast cancer that's come back after a previous breast cancer treatment. So previous breast cancer treatment is usually either an operation to remove the breast cancer from the breast, or other types of treatments as well. When we think of a recurrence, we could think of what we call a local recurrence. So that could be a breast cancer that's recurred, say, for example, in the same breast where you've had previous breast cancer. That's actually quite uncommon now with highly effective breast radiotherapy. And then there's distant recurrences, which recur in an area away from the breast. That's in another part of the body. With respect to which types of breast cancer are most likely to recur, it depends very much on the type of breast cancer and what the risk profile is for an individual patient. So generally speaking, larger breast cancers with lymph node involvement at the time of diagnosis, and other high-risk features are more likely to occur. But it's important to note that most breast cancers are cured by combinations of either surgery, followed by hormonal treatment or radiotherapy, or targeted treatments. And increasingly, as we get better treatments for early breast cancer, we're increasingly going to be seeing fewer patients with secondary breast cancer. So my main take-home message is that recurrent breast cancer or secondary breast cancer is breast cancer that's recurred after a previous treatment for breast cancer. And it can either be a local recurrence, so that could be within the breast or under an armpit, or it could be away from that.
Great, thank you. So what are the symptoms of recurrent breast cancer, and which are the most important signs?
So the symptoms of recurrent breast cancer can be a new lump or bump. So if you were to get a new lump or bump, say for example in your breast or chest wall or under your armpit, that could be a symptom of recurrent breast cancer. And other symptoms are non-specific, so general unwellness, pain in a certain part of the body. It could be shortness of breath. They're actually fairly non-specific symptoms. Generally speaking, if you've had a previous history of breast cancer and you're unwell and you're concerned about things, the way the brain works is it naturally goes to the most serious thing, thinking, oh, is that headache related to breast cancer? But the realities are although those symptoms could be related to breast cancer, they're more likely to be related to another condition. So the most important thing for you to do is, if you have got a symptom, first of all, ask yourself, is it persistent? So in other words, has it been going along for longer than a few days? Is there another explanation that could account for it? So for example, lumps and bumps under the armpit, or lymph node enlargement under the armpit can be caused by vaccination. And then the other thing to do is to seek help. So if you're in the UK and you're not sure, you can pop and see your GP and book an appointment, or book in to see your specialist and they will assess you. Most symptoms of recurrent breast cancer tend not to be that, because we all get things from time to time which are wrong with us, which, although if you've had a previous diagnosis of breast cancer, you may be naturally concerned that it could be breast cancer. Most of the time, we're able to provide reassurance to patients that it isn't breast cancer that's the problem, but something else.
Absolutely, thank you. So what is treatment like for recurrent breast cancer, and how does it differ from having breast cancer for the first time?
So the treatments for recurrent breast cancer or secondary breast cancer are sometimes quite similar to treatments for early breast cancer. First of all, it depends on the location of the breast cancer. So for example, if it was a new breast lump, then the treatment would be surgery. If there was a lump under the armpit, then the treatment for that would be surgery. And sometimes if we've just got small areas which have occurred, we can use specialized focused radiotherapy called stereotactic radiotherapy. But it depends very much on the type of breast cancer as well, in terms of what treatment you'll be offered. If you have recurrent or secondary hormone receptor positive breast cancer, then the standard initial treatment is with a class of drugs called the CDK4/6 inhibitor. These are tablets which are either taken continuously or on a 3-week on, 1-week off schedule. If you have secondary HER2 positive breast cancer, then the treatments will be Herceptin and pertuzumab based initially, and there are many other treatments that can be layered in on top. And the other thing is, if you have triple negative breast cancer, then you may be offered immunotherapy or another type of targeted therapy. The main difference is if you've got breast cancer which has spread, in other words, has gone to other parts of the body, versus early breast cancers, that the treatments we give for secondary breast cancer are given to control the cancer rather than to get rid of it completely. But particularly for some groups of women, for example, those women with HER2 positive disease and hormone receptor positive disease, that control can last to years. And it's not unusual for women to live over 5 years with secondary breast cancer, despite being diagnosed with it.
Absolutely. That's really interesting. What's the survival rate of recurrent breast cancer?
So when we think about survival, it's how long will somebody live with secondary breast cancer? And this is very, very variable, and it very much depends on the type of breast cancer you've unfortunately been diagnosed with, what previous treatment you've had, the interval between any previous treatment, and the effectiveness of any current therapies you're offered. So whenever we're thinking about survival, when if you were to come and see a doctor and say, well, look, how long am I going to live with this condition for? It is very, very variable. So it's difficult for me to give estimates for an individual person who'll be watching this video. However, for most women and a small proportion of men who get secondary hormone receptor positive breast cancer, they can now expect to live at least 5 years, with variations on that if they have really hormone sensitive disease. And it's the same for women with HER2 positive breast cancer. Survival rates are different for women with triple negative breast cancer, but a small proportion of women who get a really, really good response to immunotherapy in this setting will do very well indeed. If you are in the unfortunate position of being diagnosed with recurrent or secondary breast cancer, it's best to talk about it with your specialist rather than looking at numbers or statistics which are available on some websites, for example, in Cancer Research UK, because those statistics are unlikely to represent you as an individual person. But when your specialist said, you can talk to your specialist and say, well, look, where do I fit in within things? How do you see things going? And that will give you an indication as to the seriousness of the situation and also what you can realistically expect. And that will allow you to make plans and make some decisions which are right for you at this particular time.
Great, thank you. I think it's really important to highlight that it's still personalised. It needs to be a personalised process for the individual.
Absolutely. It's not about the numbers and saying, well, look, how well did the group do? It's about your specialist, your oncologist, their team, talking to you and your family about how they see things at the moment. And in particular, if you've been on treatment for a little while, how they see things going.
Great, thank you. So which treatment has the highest likelihood of preventing recurrent breast cancer, and which treatment is the lowest, and why?
Well, I think it's all relative, really. So I think that the first treatment you'd say does the most in preventing recurrent breast cancer is the operation. And so that's really, really important. So if you do get diagnosed with breast cancer, it's important you have surgery to remove the breast cancer. So that's the most important thing. And then other treatments, for example, hormonal treatments and targeted therapies, they provide small but significant incremental benefits, a little bit like eating bites of a cake. And so what we see is that if you're unfortunately diagnosed with a hormone receptor positive early breast cancer, on average, the treatments will help about 5 people from getting a recurrent breast cancer, which sounds quite modest. But then if you add that in with some chemotherapy and maybe some medicines to help strengthen your bones and prevent bone loss, those sort of benefits add up to maybe helping, say, 15 women in 100, which is considered to be a significant benefit by cancer specialists.
Great, thank you. And the final question, Is there any advice you would give to people, both women and men, who have been diagnosed with recurrent breast cancer?
So the first thing to say is, look, if you are in this position, unfortunate position, the key thing is to go and see a specialist to have a chat about your condition. I know that's a given, and anybody watching this video is likely to already have a specialist, but it's to make sure you've seen somebody who's familiar with your condition and can give you the very latest treatments. And so the first thing to say is, I would ask, what's the standard treatment in this condition? And that's about all treatments which are available, because not all treatments are available for every patient. And then the second thing is, is there any research which is going on? And that's really, really important, because sometimes the treatments for tomorrow are already in the clinic and being given as part of a research study. The second thing to say is that although it's clearly a very serious, and for some people devastating to receive this diagnosis, there is hope that for many people they will live with years for the condition. Now, clearly, if you're a young woman, and very rarely a man who's got diagnosed with secondary breast cancer, that's a very, very serious thing. But it will do everything we can to essentially treat the disease, prevent it from spreading. And many women and men who get this condition actually live full lives with it, and have a good quality of life. Thank you.
Perfect. That's really reassuring to know. Thank you so much. It's been a pleasure.
That's no problem at all. Well, thank you for asking me to speak to you. Thank you.
Not a problem. So if you're interested in any of the services that Dr. Tuthill can offer, visit his profile at topdoctors.co.uk.